Hello, I'm urologist Omer Erdamakaya. Today I'll give you a short video presentation on urethral stricture. What is the urethra? The urethra is the canal between the penis and the bladder. We call any narrowing of this urethral stricture. Patients with urethral stricture usually come to our clinic with complaints of difficulty urinating and a significant decrease in urine calibration. So how does urethral stricture occur? Urethral stricture most often occurs due to any trauma to the urethra. We see this very often after surgeries and after catheter insertion. It can occur with external blows to the penis. Or it may occur in patients with gonorrhea. It can happen even after kidney stones have been passed. Let's assume that urethral stricture has occurred and the patient has urinary difficulties. How do we diagnose? Diagnosis is made in two ways. First, we have an X-ray called a urethra chart. We inject a medicated opaque substance into the urethra and take an X-ray, revealing the urethral stricture. You can see these X-rays in more detail from the link to my website below. Or, we perform cystoscopy where we enter the penis with a camera, and we detect urethral stricture in the penis. What treatment is applied in urethral stricture? In fact, the treatment applied in urethral stricture is very standard. There are two types of treatment. The first is open surgery treatment, and the second is closed surgery. But there is absolutely no herbal treatment for urethral stricture, guys. I see videos on the internet making such explanations. This is my opinion, it is definitely cannot be cured with herbal treatment. Because it is mechanical problem, there is a cover or a narrow segment there. This needs to be opened, relieved, and drained in some way. I will now tell you about the closed surgery, guys. We call closed surgery an internal urethrotomy. In internal urethrotomy, the segment with urethral stricture is seen with the camera inserted through the penis. The stricture of the urethra is cut with a cold knife and opened. After a certain amount is cut, the device is passed through that narrow place in the urinary canal and the urethra is treated. In the application performed for closed urethra treatment, which we call internal urethrotomy, the patient stays in the hospital overnight. There is no wound dressing. The next day, the patient is discharged with the catheter. The catheter remains for as long as the doctor sees fit. Then, when he comes to check, the catheter is pulled. It is a simple treatment. It is a comfortable treatment for the patient. Usually, in 40% of patients, urethral stricture relapses, and this is a high rate. Open surgery in urethral stricture. Open surgery in urethral stricture can be performed in cases where close was not successful. Why don't we do open surgery as the first choice? Open surgery has harder conditions in terms of patient comfort, postoperative terms. The length of stay in the hospital is longer. It is a troublesome surgery for the patient, which we call much more invasive. The piece of skin taken from the cheek mucosa or another area of the patient is mounted on the narrow part of the urinary canal and the urinary canal is expanded. The patient's catheter stays longer than closed surgery. However, postoperative success rates are higher than closed surgery. However, this does not mean that urethral stricture will not develop again after open surgery. No matter what surgery is performed, there is always the possibility of recurrence of urethral stricture, guys. It is necessary to take this into account and explain it to the patient in this way. Apart from that, it is possible to treat the vast majority, around 95% of patients with closed system urethral stricture operation. But in recurrent patients, I think open surgery should be considered and recommended. Thank you very much for listening. If you want to read in detail or if you want to access the pictures, you can follow the link below.